Good afternoon. I'm Mark Ramey, Chairman of the Marion County Board of Supervisors. I'm with Kim Dorn, Director of Marion County Public Health. We're here to provide an update on the coronavirus vaccine distribution that is currently underway in Marion County. And Kim, it's been a while since we've talked to our residents about where we're at with coronavirus, what's kind of gone on over the last several months. I know your department, our hospitals, our healthcare workers, first responders have been very active, still dealing with this crisis. So maybe as we start off providing this update, let's give some kind of an update on where we're at, just some of the statistics for Marion County.
Okay, all right. Well, the state data is still on coronavirus.iowa.gov, so people can always go to that site and they will be able to see the data. Locally, we keep data, and ours is a little bit different than the state's, but we currently have 130 active cases. You know, since the last time we talked, it's been down, it's been up, it's been down, but we're kind of just settled in at 130 right now. We've had a total of 2,955 total positive cases that are listed on the website.
Okay.
We've had 52 deaths.
Okay.
And it's of those deaths, 65% of our deaths have been in the age group of people over 80.
Right.
And then 25% of our deaths have been in that age group of 61 to 70.
Okay.
So those are people that we need to work really hard to protect.
So as we have heard nationally, it's been no different in Marion County. The highest risk group for succumbing to coronavirus has been in that over age 60 and above group, correct?
That's correct.
Okay, because I'm looking at the numbers here, well over 80% of our deaths locally. Now, a key number here is we've had 2,854 people that have recovered from this. So that is if there is a positive to the data, that is a positive for our folks here in Marion County. Again, for all the folks that have suffered through this, one death is one too many. I know everybody has been dealing with this, both in how they've conducted their lives, the schools, first responders, government, business has been just impacted in a way. We still don't know the full impacts of what this has done to our economy and socially, how we will deal with this going forward. We've got the virus, or the vaccine for the virus out now.
We have some.
And so we have some here in Marion County. So maybe talk about phase 1A, phase 1B, let our folks know where we're at in that process.
Okay, well, phase 1A is to take care of the people in long-term care who are residents, and then also the people who take care of those people, so the workers. And then the other piece of that is the healthcare system. So healthcare providers, people who work in healthcare that have direct face-to-face interactions with patients. So they are in that 1A group.
And who's giving the vaccinations, Kim? I know public health is a distribution area, but it's going to who? Who's giving those vaccinations for that 1A group?
Okay, well, public health is doing that right now.
Okay.
And then we gave vaccine to each of the hospitals and clinics. So Pella Hospital Clinic got a certain number of doses, and Knoxville got a certain number of doses. And so it was their charge to take care of all of the people in their system that have face-to-face interactions with patients. So the goal behind 1A is to create safety in the healthcare setting, so that you know, we can say this is done, it's safe, we can set that aside, and then we can move on to other sectors.
But it's also so that people will feel safe coming back to a hospital, isn't it?
Correct.
Isn't that part of it?
That is part of it.
So people go back and start getting other treatments for things that are not coronavirus related. So
they've been putting those off.
Right.
And so it's really important for us to make hospitals and clinics safe.
Okay.
Yeah.
Okay, good. And is there, for individuals 75 and older, they're also part of that first group, is that correct, or are they in the next group?
They are in group 1B.
They are in group one B.
They are in group 1B.
So what is group one B, or will that be?
Well, 1B was just introduced yesterday for planning purposes, so it will include the folks who are 75 years and over, and essential frontline workers, the rest of the healthcare system employees
Okay.
that aren't taken care of in 1A. And so it's a really big group.
Okay, schools and those folks, are they in one B?
They're in 1B.
They're in one B
Mhm.
as well. So how do we, since we're currently in the one A distribution, for lack of a better term, that phase, when do we know we're done and we move to one B? Who tells us that?
Well, we get orders from the state, and so we are right now under shortage orders, and those orders cover 1A.
Okay,
So we won't move forward in Marion County, or shouldn't be anywhere in the state, to move forward until we have orders to move on to 1B. And when the state gives us our orders, they will give us the parameters of who we can serve.
okay. And just so everybody's clear, the reason for that is the number of vials of vaccine that we have received, correct?
That's right, the vaccine is not coming in very quickly.
Okay,
There's a lot of variables in all of this, so lots of moving parts, but right now, coming to the public health system, there are about 19,000 doses per week,
okay.
and that's
That's statewide?
that's statewide.
Okay,
And so that's to take care of this whole 1A group. So we're a long ways from being done with 1A. Well, I don't wanna say a long ways, we're a few weeks probably, at least, from being done with 1A. Because we may be almost done here in Marion County, but the University of Iowa, those big providers that have thousands of
Sure.
employees,
yeah,
that the vaccine's just not coming in fast enough to get all of their people offered.
okay, very good. So just for our residents to understand, that we're currently in one A as far as the distribution plan that we were given by, comes from the federal government to the state governments, and then the state government tells us how we are going to go about that distribution process.
Correct.
So we're in the phase 1A. We, to a large degree, are, it depends on the amount of vaccine that we receive.
Mhm.
That does, not something we control, that's something that's controlled by the federal government, again, to the state.
Right.
And the entire state of Iowa is getting about 19,000 vials of vaccine. How often?
19,000 doses now.
19,000,
Yeah.
19,000 doses
per week,
per week.
and of the Moderna, and then that's a separate pot of vaccine from the long-term care.
Okay,
So that's just to take care of the healthcare infrastructure
because the long-term care folks have contracted
with a different group.
with other groups
With a
that are
different
taking
group.
care of them. Okay, very good. And we don't know, as other vaccines come online, whether this will change. It probably will, if they do and when they do, but we don't have any
We have no
information.
information on any, any timelines on more vaccine coming online.
Okay,
Well, there's some in the pipeline, we just don't know when.
it will
Yeah.
happen.
Yeah, and they've not received the authorization and
Right.
things.
And just again, so our residents understand, we're going through a change of administration. So without making this a political statement, are you having to wrestle with that at all? Is that changing based on what you heard before the election, up to, right after the election to now? Are there changes in the strategies that are impacting how we have to respond?
There's a lot going on right now, just with the change in administration, and the change in direction for planning purposes, because what we had planned was very planned, and we knew exactly how we were moving forward. And we just got information today saying that the plan that we have in place is probably going to be revised.
Okay,
But we don't know what's going to be revised in it, or we don't know what their expectations are. Those are still very vague. So they're still working on that up there at the state and federal level.
Okay.
It's going to be, a little disjointed for a little bit until everybody get their feet under them and get the, and get the new plan in place.
I mean, it's a massive undertaking
Mm-hmm.
to produce vaccines this quickly, this number of vaccines, test them for safety and
Mhm.
efficacy and all those things.
Right.
We go through a change of administration, there will be some different strategies, it's a
Yep.
fluid situation from
Right.
that perspective. Okay, very good.
Yeah.
So that our residents understand, we're responding to those things as we get different sets of information from the state and from the federal government. Our hospitals will respond to that as well. I assume that we're in communication with both of our hospitals.
We meet with them at least once a week.
Okay, very good. And I know that they're gonna do everything that they can to make sure this is as smooth a process as possible,
Yeah.
given all of the things we're talking about, all the different variables that are a part of this process.
Mm-hmm. There's a lot of moving parts, and there's a lot of moving parts for everybody, and there's a lot of choices to be made about how these things are going to be delivered by the providers. So each of the hospitals has to do their own planning, and they're dealing with the same things that they don't know that we don't know. We don't know how fast the vaccine's gonna come, and so I don't know. All of the vaccine the vaccine count comes to Marion County Public Health, and then I allocate it out to approved providers.
Okay,
And so there are more providers than just the two hospitals. Until actually vaccine starts rolling, it doesn't make sense to bring a lot of others in yet.
sure.
But there'll be learning curves for everybody. Some things that people might want to know, depending on where you get your vaccine, when it's time. The vaccine you can't be charged for the vaccine, but depending on where you get your shot, you might be charged an administration fee, or
Okay.
your insurance might be charged, and those kinds of things. So as the information rolls down to us and it gets a little more clear, then we'll be able to clear things up and push the information out to the public.
Okay, very good. So we'll plan on doing some of these types of updates then as we go through this process. Kim, for the folks and entities that are part of Phase 1A and 1B, where can people go to find that? And if they just wanted to read, who is that in these first two groups?
Well, we'll put some updated information on our website, so at marionph.org.
Okay.
And then we'll also push it out through the JIC. I've been reaching out to Dr. Bob for KNIA KRLS, so check your local media. Also, you can go to the CDC website, and information is there. The Iowa information might be a little bit different than what you see on the CDC, but that should give you the broad categories and kind of an understanding of what direction they're going.
Okay, very good. So please check all those information sites. Again, we'll have those listed on our Marion County Public Health site and other places where you can get access to this information. If you have questions, can they call Public Health for questions, or is there a contact place where people can call?
There is. We're getting a lot of calls right now.
Sure.
But probably one of the easiest ways to do it, because we're all just incredibly busy right now, is if you would email at COVID-19 at marioncountyiowa.gov.
Okay.
And then I will answer those emails. It's kind of a constant process.
Yeah, you bet. So we will get that out as well on our joint information page. We'll make sure the media has that as well, that email address and place for you to ask questions. We'll do more updates like this.
Great.
Kim, is there anything else you want to add before we wrap this update up?
I really want to encourage people to continue with the mitigation strategies that we've talked about all along. Because I think one of the things is that people they're tired of doing those things, and so that's why they're really, they're really enthusiastic about getting the vaccine. But, it's gonna be a process, it's gonna take a while. I don't expect that it's going to be available broadly to the public until at least spring. And so we really do need people to continue to wash your hands, social distance, be extra careful if you're in a large group. Wear your masks if you're required or if you feel like you should. And above all, stay home when you're sick, and if you've been positive, if you're sick, or if you're quarantined, please just stay home and let's not spread it around.
Okay, very good. Well, thank you for joining us for this update, Kim. We'll have more updates as conditions warrant on the vaccine distribution. Have a great afternoon.